Your liver is one of the most vital organs in your body, acting as a powerful filter that removes toxins, waste products, and harmful substances from your bloodstream. When your liver isn't functioning properly, it can lead to serious health issues such as jaundice, mental confusion, fluid retention edema, or dangerous electrolyte imbalances. Because of its critical role in overall health, many supplements on the market claim to promote liver function and detoxification. While not all of these products are proven to work, some individuals can benefit from vitamins for liver detox and overall liver health, especially those with digestive disorders, food intolerances, non-alcoholic fatty liver disease, NAFLD, or cirrhosis. Key nutrients that experts often recommend for liver support include vitamin D, vitamin K, and omega-3 fatty acids, among others. 6 essential vitamins and supplements for liver health. If you struggle to maintain a balanced diet or have a gastrointestinal condition that affects nutrient absorption, a vitamin deficiency could be impacting your liver health, explains Kristen Kirkpatrick, RD, dietitian at the Cleveland Clinic Department of Wellness and Preventive Medicine. Starting with a high-quality multivitamin can be beneficial, ensuring your body, and especially your liver, receives the full range of nutrients needed for optimal function. For individuals with chronic liver disease, specific vitamins and minerals may provide additional support. While there is no single supplement that can instantly restore or cleanse a liver, certain nutrients are known to aid in its natural detoxification process. Based on your health status and dietary habits, your healthcare provider may suggest targeted vitamins for liver detox to improve overall liver performance and resilience. 1. Vitamin D. Vitamin D is one of the most important vitamins for liver detox and overall liver health. Research shows that a deficiency in vitamin D may increase the risk of cirrhosis, and once liver disease develops, restoring optimal vitamin D levels can be challenging. Among patients with cirrhosis, vitamin D deficiency has been linked to higher rates of infection and increased risk of mortality. Similarly, in individuals with liver cancer, low vitamin D levels are associated with poorer clinical outcomes. Kristen Kirkpatrick, RD, notes that vitamin D deficiencies are particularly common in certain liver conditions. One study highlights that people with severe liver failure or cholestatic liver disease frequently have low vitamin D levels. For these individuals, vitamin D supplementation may be beneficial. However, current research does not provide conclusive evidence that supplementation improves long-term outcomes. There are no universal guidelines on the exact dosage of vitamin D for those with liver disease. Studies have recommended daily doses ranging from 800 to 2,000 IU for individuals with cirrhosis or cholestatic liver disease. In cases of malnutrition combined with liver disease, even higher doses may be necessary, with target 25-hydroxyvitamin D level of above 30 nanograms per milliliter. 2. Vitamin K. Vitamin K is another key nutrient often included in discussions about vitamins for liver detox due to its antioxidant properties and its ability to neutralize harmful free radicals, explains Nancy Ampadu, an MD, a physician at Sonoran University of Health Sciences in Arizona. It plays an essential role in protecting against non-alcoholic fatty liver disease, NAFLD, and is also critical for production of blood clotting factors, which help prevent excessive bleeding. Vitamin K deficiency is frequently observed in individuals with liver disease. For those with low vitamin K levels, supplementation may help reduce complications associated with NAFLD and potentially slow the disease's progression. Emerging research also suggests that vitamin K could support liver function in people with cirrhosis and even promote liver regeneration in patients who have undergone a partial hepatectomy or liver resection. Beyond its liver protective benefits, vitamin K is known for strengthening immune system function, reducing inflammation, and supporting a healthy gut microbiome. The typical recommended dosage of vitamin K ranges from 90 to 120 micrograms per day, but it is important to consult your healthcare provider before starting supplementation. Dr. Ampadu cautions that vitamin K supplements are not suitable for everyone, particularly men with or at high risk for prostate cancer, individuals who have experienced a hemorrhagic stroke or heart failure, people with blood clotting disorders, or those taking anticoagulant medications. 3. Choline. Choline is an essential nutrient produced in small amounts by the liver, but not enough to meet your body's needs. To maintain optimal liver function, you must obtain additional choline through your diet. Foods rich in choline include beef, beef liver, egg yolks, fish, legumes, and chicken. A lack of choline in your diet can significantly increase the risk of fatty liver and other liver-related conditions. One of choline's key roles is helping to remove excess fat from the liver, thereby preventing fat buildup. Several studies suggest that a higher dietary intake of choline may reduce the risk of developing non-alcoholic fatty liver disease, NAFLD. Although there is no definitive standard for the exact amount of choline needed to optimize liver health, the recommended daily intake for most adults is 425 to 550 milligrams. Including this nutrient in your diet or as part of a supplement stack that include vitamins for liver detox can provide essential support for overall liver function. 4. Vitamin C. While vitamin C is widely known for its immune-boosting properties, it also plays an important role in supporting liver function and detoxification. Research suggests that vitamin C supplementation, particularly at doses around 1,000 milligrams per day, may improve several markers of liver health, especially in individuals with non-alcoholic fatty liver disease, NAFLD. A review of scientific studies also indicates that people with NAFLD are more likely to have vitamin C deficiencies. Low levels of this vitamin can make the liver more vulnerable to inflammation and oxidative stress, both of which can accelerate liver damage. Ensuring adequate vitamin C intake, either through diet or supplementation, can therefore be a valuable part of a regimen focused on vitamins for liver detox and overall liver health. 5. Omega-3 fatty acids. Omega-3 fatty acids are often highlighted as essential nutrients for heart and brain health, but they also play a significant role in supporting liver function. Research shows that omega-3s can help reduce inflammation and oxidative stress, two major contributors to liver damage, and may decrease the accumulation of excess fat in the liver. A comprehensive review of studies suggests that regular omega-3 intake may lower the overall risk of developing liver disease. However, not all omega-3s are equally effective for liver health. According to research, DHA, docosahexaenoic acid, appears to be far more beneficial than EPA, eicosapentaenoic acid, in improving liver function and preventing tissue scarring associated with non-alcoholic fatty liver disease, NAFLD. For those aiming to use omega-3s as part of a vitamins for liver detox plan, recommended supplementation ranges from 200 to 1,000 milligrams per day, depending on individual health needs. 6. Probiotics. While not a vitamin, probiotics are often included in discussions of liver detox supplements because of their powerful impact on gut health, which is directly connected to liver function through what is known as the gut-liver axis. A balanced gut microbiome can reduce liver inflammation, improve digestion, and slow the progression of liver disease symptoms. Probiotics have been shown to potentially improve fatty liver disease by supporting a healthier microbiome, alleviating liver injury, and strengthening the intestinal barrier, explains Kristen Kirkpatrick, RD. A comprehensive research review highlights multiple studies examining the relationship between probiotic strains and liver health. Many participants, often diagnosed with non-alcoholic fatty liver disease and NAFLD, were given one or more probiotic strains, frequently including lactobacillus species. Most studies found at least one measurable improvement in liver health markers after consistent probiotic use. Incorporating probiotics into your wellness routine alongside vitamins for liver detox may enhance both gut and liver function. What to look for in vitamins for liver health. Many vitamins and supplements marketed for liver health make bold claims, often promising to detox your liver or act as powerful antioxidants. However, what these products rarely emphasize is that your liver is already a natural detoxification powerhouse. It performs these functions every day without the need for special supplements. Even if your liver is under strain, there is no scientific evidence that a single supplement alone can fully restore or cleanse it. That said, there are situations where vitamins for liver detox can be helpful. Individuals with nutritional deficiencies, poor dietary habits, or chronic liver conditions such as non-alcoholic fatty liver disease, NAFLD, or cirrhosis may benefit from specific vitamins and supplements. When used alongside a healthy diet, lifestyle changes, and prescribed medications, certain nutrients, like vitamin D, vitamin K, choline, vitamin C, and omega-3 fatty acids, can provide supportive benefits for liver health. Always consult with a healthcare professional before starting any new supplement, as dosage needs vary and certain vitamins or minerals may interact with medications or underlying health conditions. Take the next step. If you found this information helpful, make sure to subscribe to HeInfo for expert-backed videos on health, wellness, and nutrition. Like this video, if you learn something new about vitamins for liver health, share it with someone who might be interested in protecting their liver naturally. Comment below with any questions or topics you'd like us to cover next.